afternoon. Please excuse my appearance, but I was wearing greens, and you can't wear greens when you're using one of these things behind me. So this is MTP number 42. And I got a series of questions from one patient named Callum, but I mostly want to address the angle of the dangle. Okay, let's call this episode the angle of the dangle. He said that he describes his history of failing PDE5 inhibitors, and then he asked a question: erection angle. I know every guy is different, and angles can vary, but I currently stand at 12. Well, I guess he means he's sort of, if he's laying this way and the penis is on the clock this way, straight up and down, instead of more towards his chin. And will he have a problem once he has an implant? Will it ruin my angle? And apparently he's read that or heard people complain about having the penis face down. It's interesting because we did some cadaveric studies looking at where exactly do you need cylinder and where don't you need cylinder. In other words, the penile implant's made up of cylinders, and then you might have something called rear tip extenders on the back of it. And what we found was that, assuming that you weren't going over 2 centimeters on the back of the cylinder, meaning that's the part of the implant that's pushing it further forward, that you wouldn't have one of these diving board phenomenons where it kind of drops down. So in other words, experienced implanters will try to put cylinder across that area where the penis would want to hinge down. So as long as you got cylinder that's in that area, you should be able to maintain that angle. I can tell you that I have a lot of guys that say, hey, look, my penis faces down. And when I pull up their pannus, in other words, that roll that lies on top of the penis, the penis comes right back up. So I would say that in the experienced hands, most of the penises that point down, it's because you need to lose some weight. You also probably have some penis inside there. Just to finish up his other 2 questions real quick, he asked about venous ligation. I can tell you that was abandoned about 1996, 95. That's when you have a venous leak, and that's what's causing you to have erectile dysfunction, which is the majority of my patients because they need a penile implant. They used to tie off those veins, and they would just come back with a vengeance. So I know there's still a few people that sort of market that. I would stay away from that altogether. And finally he asked, what's the youngest guy I've ever implanted? And that gentleman's 21. And so I'd done his brother, his uncle, his father. They had a genetic venous leak. So that covered a couple of extra topics. But the most important thing on this one is that in experienced hands, you should be able to maintain that towel hanging angle, which all of us are looking for. If you looked in my phone, you'd see a lot of those pictures. So hey, we'll see you for MTP number 43. Thank you very much, and you guys have a great day. Bye.